Hey guys, and welcome back. I'm gonna update you regarding my travel nursing contract. So, I'm on my second week of travel nursing. On my second week, the first night is shadowing with another nurse for 12 hours. So, I'm gonna show you what are the pros and cons of working in this facility here in California. So, the first pro is that I got a good paycheck just this week. I'm gonna show you here how much I got paid this week, and also I'll show you the taxes that they've got from my paycheck. So this paycheck is gonna be my weekly paycheck for 13 weeks. So it's a lot better than being a staff in Florida. All right, the second pro is that the full-time staff gets paid way more than the travelers, which means the full-time staff don't get jealous or resentful with the travelers because they get paid more. So they support their travelers, and travelers feel safe and feel like they're supported by the staff. On my first night by myself, they were very helpful. I would be asking, where's this, where's that? And they're all so nice. Nobody was mean. No one was like rude. They were really helpful to the travelers. And some travelers apparently became staff or have been going back to that facility because the staff are so nice. Another pro is that they make sure you get breaks. They make sure that you get uninterrupted breaks from 30 minutes to an hour. On my first night by myself, my coworkers were like, "Have you had your break? Make sure you get your break." And then they'll be like, "Oh, go to sleep on your break." They would even show me the room they would take a nap. They would give me warm blankets. They're so nice about it. And then there's this break nurse who would come to you and ask, "Hey, what time do you want to take your break?" And while on your break, they make sure that break nurse watches your patient in case something happens, so you won't feel anxious as to what is going on with your patient while you're on your break. So it's a really good thing having a break nurse. So now let's talk about the cons. So this is a smaller hospital, which means they have about one or two cardiothoracic surgeons. And in about a month, they only get about one or two valve or anything heart patients, a true heart patients, which means you might lose your skills. Also, as a travel nurse, you won't be able to handle impella, balloon pump, CRRT, any of those critical machines because they give those critical patients to the staff. Another con is that the training is not as good as compared to my previous hospital. In my previous hospital, we have about 4 to 5 cardiothoracic surgeons, and every week we got a lot of open hearts, valves, anything heart patients, and those new nurses that we train gets trained a lot because they're able to take care of a true heart patient. Another con is that it's a smaller hospital, so their ICU rooms are also smaller. Their toilets are hidden under a cabinet, which you have to like pull for the toilet seat to come out, and then you have to push to hide the toilet seat. It's a bit crowded and unorganized. And that's what I miss with my older hospital because the facility is bigger. The ICU rooms are bigger. They have washing machines. They have big couch for the visitors. Another con that I think not as good is that their respiratory therapist has a lot of responsibilities. Their respiratory therapist also do the EEG and EKG. Aside from the vents and breathing treatments, they're really worked. Compared to my other hospital, we have a different person specifically for EEG and another person specifically for EKG. So the respiratory therapist would just focus on their patients on the ventilators, BiPAPs, breathing treatments. And I think it's also because the hospital is smaller. I think that's all the cons, but I'm really enjoying my contract right now. Even if it's smaller, I like to see the different takes on different hospitals. But I want to warn everyone who wants to be in travel nursing, you have to be able to be flexible. You need to be able to get out of your comfort zone because you could get floated anytime. I'm a CV ICU contract, but I've already been floated to the neurotrauma ICU. You could get floated to the ER, the regular med-surg floor, the PCU. So you need to be really flexible and you need to be able to learn quick. Yeah, you need to get out of your comfort zone, but you get paid more. So that's the thing. Hopefully this video helps you, and I'll keep updating as I go through this 13-week contract. Thank you.